Hey guys, it's Raven, and I'm going to be presenting on xylazine for my plant and animal toxicology class. So, xylazine, it's an organic heterocyclic compound. It is similarly structured to phenothiazines and is also categorized with them. They're used for antipsychotic properties in medication and also tranquilizers. The molecular formula is C12H16N2S. From the IUPAC name listed, you can see it's a pretty lengthy name, and I am not even going to get into that. So, overview of xylazine. So, it was originally intended for veterinary medicine and it is still commonly used in veterinary medicine. It's only approved for use in animals and it is not approved for use in human medicine. And we will get into that in just a couple minutes. But the generic names include rompin, cetazine, and anisad. And as I said, it's used in veterinary medicine. It's mostly used to cause muscle relaxation, sedation, and relieve pain, and it helps prepare animals for surgery. It's also a non-opioid sedative. So, introduction. So, xylazine has found its way to illicit drugs, and this is becoming an increasingly more dangerous problem. It's commonly referred to as tranq in street terms because of its tranquilizing properties, and it is usually in a liquid form at first. It's used to adulterate and cut other illicit drugs, specifically opioid drugs. Those are the ones that it is most commonly associated with and found with. Um, it's a very cheap drug. It's much, much cheaper than fentanyl, much cheaper than fentanyl. So it is way more of an economic gain for these drug traffickers and distributors because they save money while making a greater profit. They convert it to powder form from the liquid form via drying methods or salting methods as well. Handlers use xylazine in a method called cutting, which helps disperse the product to greater lengths and greater amounts, allowing them more product to sell and profit to gain. And the dosage is usually unknown in illicit drug cases, which is another reason that it can be so dangerous. So, how does xylazine act? Well, it is an alpha-2 adrenergic receptor agonist. Functioning as an agonist causes a decrease in the norepinephrine and dopamine that is released into the central nervous system. This results in sedative-like properties along with muscle relaxation and analgesic effects. It quickly crosses the blood-brain barrier also, and it significantly depresses the central nervous system. It has very, very strong sedative-like effects in animals and humans. Other effects of xylazine include serotonergic, cholinergic, dopaminergic, and histaminergic issues. So, side effects of xylazine use in humans. Well, first, it is utilized through ingestion. It can be smoked, insufflated, which is snorted or, breathed in some form, or injected into muscles and veins and things of that sort. Effects of xylazine last for up to 4 hours in animals, but it's unsure how long effects can last in humans. Now, knowing this, it is actually eliminated rather quickly from humans, but it is absorbed dangerously quickly as well due to its lipophilic properties. Side effects of the veterinary drug in humans include bradycardia, which is lowered heart rate, hypotension, which is lowered blood pressure, decreased brain activity, severely depressed breathing rate, brain hypoxia, and sedation. And those were reported by the CDC in 2024. Other side effects include progressive and painful skin necrosis near the injection site and also on other various bodily areas. Skin necrosis leads to the necrotic skin lesions that are difficult to heal without adequate resources, and constant supervision. They need to be cleaned and treated properly very regularly, especially once they get to a certain point. And also, not taking care of this, not getting them treated and cleaned properly has led to amputations in people that have repeatedly been exposed to xylazine, whether they intentionally knew xylazine was in the drug or not. And these skin ulcerations, they're due to vasoconstriction, which is a very common side effect in xylazine. Vasoconstriction is responsible for restricting blood flow in localized regions, leading to lowered skin perfusion. So sufficient blood flow to the skin is imperative for nutrient delivery, temperature regulation, wound healing, and healthy skin. Is Vasoconstriction significantly increases the chance for superinfection and skin ulcers. And repeatedly used injection sites are at the greatest risk of skin ulceration, but ulcers have also been shown to appear in distant regions from the injection site as well. Repeated xylazine use dramatically increases the risk of developing large skin lesions dispersed throughout the body. So if somebody is injecting xylazine into their arms, they typically do get a pretty difficult skin lesion that does appear. But what we are finding is that these lesions have actually spread throughout the body. So somebody can be injecting this drug into their arms, but they can also get skin lesions around like their feet. Completely distant regions of the body are appearing to show these skin ulcers and wounds as well. And also what makes this even more detrimental is that these ulcers can reach soft tissues and create necrotic wounds when they're not treated properly. And so if you have a queasy stomach or you do not like the look of wounds, skip over this next slide because I'm including a photo of what these xylazine wounds can look like. And I am switching right now. So this is a xylazine skin wound. And as you can see, it's pretty gruesome. These don't even look like skin wounds to me. These look like someone took open flame to their skin. I mean, they are burned. And then this one over here is one of the worst that I found. It has completely deteriorated that top level of skin right there. I mean, it just looks like it is absolutely destroyed, and you can see some soft tissue underneath peeking through. And that is a very, very necrotic wound. And that is one that would take consistent and constant treatment, cleaning, and upkeep. I found some as well that showed where the skin and muscle had just completely deteriorated and all you could see was bone. I did not include those, but feel free to look this up if you would like. Some of these wounds can get pretty gruesome. So side effects continued. The severe depression of the central nervous system has led to overdose and death in multiple cases. Xylazine adulterated drugs have been present in numerous overdose cases within the last 5 years. Cleveland Clinic reported that xylazine-related overdose rates increased by 1,127% within 1 year. That is astronomical. The CDC has also reported that 2.9% of xylazine fentanyl-related deaths in 2019 increased to 10.9% in 2022. That is just within 3 years. Multiple agencies are reporting xylazine to be a rising concern, and it is not getting any better currently. Aside from the side effects of xylazine, the real danger lies in it being nearly irreversible. So I know most of you have probably heard of, fentanyl overdoses and Narcan that can reverse the overdose. Well, Narcan has absolutely no effect on xylazine. There is no current medication available to reverse xylazine adulterated overdoses. Like I said, Narcan reverses fentanyl and other opioid overdoses, but it has zero effect on xylazine. And the symptoms such as bradycardia and hypotension, those are the symptoms that can be tended to through medication. Those are the symptoms that can be monitored along with the skin ulcerations. However, if someone has, dramatically overdosed on xylazine, there is no medication out there that can truly help the overdose. It can just help. They can find medications to help the symptoms. And this is why xylazine is so toxic in people. And as I mentioned earlier, skin ulcerations can be cleaned and treated, but most of them are found to be progressive and ongoing, and they require persistent cleaning and upkeep. And these untreated necrotic wounds have led to amputation, bacteremia, sepsis, and even death. So in conclusion, xylazine is extremely harmful to humans, especially in large doses. And it is absolutely terrifying that people have no idea a lot of the time that xylazine is included in their illicit drugs, and they have no idea that which dose it is either. A medication specific to reversing xylazine and inhibiting its chemical cascade has not been successfully manufactured yet. and this makes consuming xylazine through any method exceptionally dangerous and hazardous. Xylazine continues to be problematic, prevalent, and dangerous while being placed in the hands of careless and perilous individuals. The risk of large and unbearable skin ulcers, amputation, severe CNS depression, overdose, and death are associated with xylazine consumption. Seriously, guys, don't do drugs. Just don't. Stay away from them. Have a good day.